I study horses, beauty matched only by their strength. So here we are at Pilchuck Vet Hospital. We're looking at this horse here who presented at the hospital to one of our surgeons for laminitis. Presented with some pretty severe pain. It was hospitalized to stabilize his pain. And now here we have our set of glue shoe clogs that we've applied to him that we're resetting here to keep him comfortable. When he presented to the hospital, he was in pretty severe pain, would often be lying down in lateral, had some pretty severe digital pulses, and he was put in soft ride boots to kind of stabilize his foot. He was on pain meds to help get the inflammation down, and he was also on strict stall rest. After a few days of therapy, support, and bute, he was released and he was very comfortable. So we decided to put him in clogs to realign his, start realigning his hoof capsule with the new rotation of his coffin bone. So here we're just dressing the foot, getting it ready for x-rays to kind of recheck where everything is at in his foot. And this guy, when they tend to be foot sore in the front, they don't like to use their back, so they pull on you a little bit, but he's a really good boy. And so here we're just getting ready for the x-rays. We dressed and cleaned up the foot. We didn't really do a trim yet. We're just cleaning up the foot to get a nice clean x-ray. And ideally you want to have the feet on two blocks to get a good medial lateral view, but we just wanted to keep them comfortable, so I was more worried about keeping them comfortable than getting that perfect medial lateral view. So we just did one block at a time to make sure he was comfortable. The whole goal of this shoeing is to realign that hoof capsule over time with that new angle and rotation of the coffin bone. And so we got our x-rays, and you can see there a bit of rotation of P3, or the coffin bone, that's misaligned with the hoof capsule, because the new hoof wall growing down is going to want to align with that new coffin bone. But if we don't encourage that new growth to realign with the coffin bone, then it's going to get that slipper foot appearance that we often see with these chronic laminitis horses. If we don't manage them in that way, that's what we end up with. So you can see I started off with trimming our heels first, because the biggest thing about these slipper-footed horses is that their heel gets way out of control. The frog can't touch the ground. Our caudal foot gets very weak and contracted. What I'm doing here is basically trying to get as close to a palmar angle of 0 as I can with our heels, just getting down to almost not sensitive tissue, but trying to get down to as much as I can to get those heels contacting the floor. And then when I draw that palmar angle of 0 forward, there's a point where it crosses the sole, and that's where I'm rockering that toe there. So all the hoof that's being rockered at this time is not active. It's not being used, and really I want to disengage this portion because this is that hoof wall that is basically causing a leverage point, and I want to disengage this portion so that the new hoof wall growing down isn't being dragged forward by this irregular hoof wall. And so I'm just giving a little rocker there to disengage it while keeping a strong rim of hoof wall material and almost floating that middle toe portion right in front of the frog. Not intensely, but when you look at a plain view of the shoe and the foot, that solar portion of that trim has just a little float on it, so it's disengaged. And basically what we're trying to do is just decrease the biomechanical leverage on the front of the coffin bone. We don't want any leverage on the front of that coffin bone, so that's why we're focusing on breakover and getting that trim correct and disengaging that sole surface right at the tip of the coffin bone. And trimming in this style also kind of retains any of that concavity that we have at the tip of the coffin bone, so it's not flat and contacting anything on the shoe or the ground, and that's what's going to give us strength. So here we start with a glue shoe. So I like using these to make my clog type shoes. I still use clogs every now and then, but I feel like for these more chronic cases that are decently comfortable, I can get more of a custom fit. And so I can customize the solar pressure, I can customize the angle and the breakover. So here we shape the glue shoe, and now I'm cutting out the pad that will go inside of it. So you trace the perimeter of the glue shoe, and then you're gonna notch out the portions of the glue shoe that are a little more in, and they have a lot more of a stable stance. So you're getting the effect of a clog, but you're also getting a very stable stance. And so here I'm just grinding out that shape so it perfectly matches the glue shoe. And sometimes it takes a little bit of going back and forth to figure out the perfect shape. And so there I'm just making sure that shape fits inside the cuffs of the glue shoe. I want a nice smooth perimeter going around that glue shoe. And then once I'm happy with that, what we're doing here is adding a stacked rim pad to this. So there will be, from the ground surface up, there's going to be a regular flat pad. And then on top of that, we're going to have riveted in a rim pad. And what that's doing is basically giving some false concavity or some built concavity to the foot. And so we don't want a flat foot. Flat feet, that coffin bone is going to be feeling that much more pressure um, with any kind of sole pressure that we try to put on there. So some false concavity is going to add some strength to the foot and also some relief. So I don't want the hoof directly contacting the pad because that pad doesn't have any soft relief. It's hard. So what we want is that foot only contacting either the silicone packing or the DIM material, the dental impression material that we're going to pack that foot with. And so this stacked rim pad is going to allow for that foot to only contact the pad on the rim of the foot, which is the stronger part and the weight bearing part, and the sole can get some relief and contact only the packing material. Because he does have a very flat foot, so if we just put a flat pad on him and tried to squeeze some silicone or DIM in there, a lot of his foot would probably be contacting directly to the pad, and that might get some pressure points or soreness. And right here, I'm just marking the sole part of the pad. So when I'm cutting and trying to rivet, I'm putting the correct orientation of the pads in the right order, basically, because it's easy to get mixed up when you're doing all this. And here we're just drilling the rivet holes. So I'll drill right into both of them. And in the interior of these glue shoes is an aluminum shoe, and the rubber's vulcanized to the aluminum shoe. And so you can really customize these in any way you want. And so here, after I've drilled the rivet holes, I'm cutting out the rim pad. And a lot of these if I'm doing just a glue shoe, I'll rocker the heels. You can roll the toe. You can grind a roller into the toe. You can do quite a bit with these shoes. And this tends to be the hardest part of the whole thing is squeezing those rivets into these holes in the pads. So you can see, like, if I didn't write S, it's kind of confusing on what side matches with which. And here, just getting the whole package lined up together. And I find with these rivets, when you're doing a single pad or multiple pads in the glue shoe, that trying to hammer them straight into the shoe like you would a normal steel shoe, the pad tends to get moved around. So what I do is bend them over and then just grind them off later. The thickness of the glue shoe, I feel like there's some shifting around, and with the softness of the rubber, if you try to compress the rivet straight down, it moves the pad around quite a bit. So I find that bending it over backwards locks it in just a little better, and that's what I've found works. There might be a lot of others out there that find it easier to compress it straight down. Now I was just trimming the perimeter of the pad to the glue shoe, and here I'm just giving some relief points. So right at the tip of the toe, and giving some sole relief. And really, I just want a thin rim at that toe. During the trim, when we floated that middle toe area, so there's no leverage effect, I'm just kind of relieving that any sole pressure that could be possible by grinding down that toe area and just making sure these heels have a smooth exit. And so here I'm building up the club effect with a urethane, fast setting urethane glue. So I put a fresh grind at the bottom of the shoe just so it's nice and clean and a nice surface for the glue to stick to. And this fast setting urethane glue I'm just building up so then I can shape a heavier roll effect or like a clog effect into this shoe. And so what we're trying to do here is during the trim, we took down the heels to further realign that hoof capsule, but then that decreases our palmar angle, that decreases our hoof pastern axis, and that is increasing the tension on that coffin bone with the deep digital flexor tendon, which originally caused the rotation. So what we're doing with this wedging effect is trying to relieve that tension. So the trim is trying to realign the hoof capsule while the shoeing package is trying to relieve all that biomechanical leverage. So our breakover point should be just under the tip of that coffin bone, and we want there to be ease of breakover kind of in all directions while also wedging the foot a bit to relieve that deep digital flexor tendon. And then slowly over time, as the foot gets stronger, more hoof capsule grows out, we can lessen and lessen that angle. And so here we're just prepping the foot. So just top dressing the hoof wall and not overdressing that hoof wall. We want to keep as much thickness to that dorsal hoof wall as we can. We don't want to overdress it so it's perfectly smooth and then over thinning it. We want to keep the thickness to that hoof wall over time. And so we just dressed it up. We gave it a burn with a torch just to get any debris off of there because the glue does not like debris. And here I'm using a soft dental impression material as my sole packing. And we want some engagement to the foot. We don't want to, sometimes they can have a really sensitive sole, but we want some engagement and support. You really want to relieve the tension and the pressure at the toe, but we want a lot of engagement towards the back of the foot. And here he was doing pretty well, so we're just doing uniform engagement. You can also use two different densities of dental impression material, softer at the toe, more dense at the heel, to kind of have a differential engagement. So here, just cleaning up the foot, and I'm using the glue shoe prefix spray. And what that does is allow for you to put the foot back down and do a more proper gluing from the ground. So the saran wrap isn't the only thing holding the shoe on. So this stuff instantly cures. So you have a nice strong hold that can essentially prevent any shearing effect once the horse puts his foot back on the ground. So that can then allow you to put the acrylic or urethane glue behind the cuffs after the fact. And it's a really handy little tool. It's kind of changed my routine with doing these glue shoes and a lot easier for application, especially with horses that are painful, that want to put their foot down pretty quickly. And you don't have to mess around with just the glue on the cuffs trying to move around when you're trying to do the saran wrap. And then I always help them down so they don't shear it. And so here I've put the glue under the cuffs, and I'm just putting on this saran wrap to smooth that application and keep them nice and tight while that glue cures. Once that glue is under the cuffs, you don't want the shoe moving. And that's why that prefix glue is really important because it keeps the shoe from shearing at all and moving and breaking those glue bonds. You want to keep it as strong and still as possible while that glue is curing. After we put that fast setting urethane glue on, I also ground and shaped the glue. So there's a really nice, easy breakover at the toe and on the toe quarters. So when he tries to step, it's a really smooth, easy breakover, and there's no biomechanical leverage. And so here we're just doing recheck x-rays to make sure our shoe is right where we want it. And you can see that rolled toe and that breakover at the quarters, but he's got a really stable caudal foot. So the fast setting urethane glue is really kind of stabilizing the back of his foot, but any way his foot wants to roll forward, it's going to be an easy step.
Chewing boy, good job.
And so here we're checking the before and after, and you can see the increase in the palmar angle and reducing that biomechanical leverage on the deep digital flexor tendon. And you can also see he's growing a decent amount of sole, and our rockered toe on the x-ray, you can see it ends right under the tip of the coffin bone, and that's what we want. We're trying to disengage that hoof wall that is where the lamellar wedge is, where the rotation happens, and we're trying to encourage that new hoof wall growth to grow down along that new angle of the coffin bone. And that's very much easier said than done. Some don't want to grow, and you really have to be more aggressive about disengaging that dorsal wall. And he walks out pretty comfortably, ease of breakover. He's still a little sore on his turns, but he's got more hoof wall to grow, and he's a happy horse going home. So we'll see him again in about 5 weeks and reset that same shoe, just constantly reevaluating his comfort level and what changes we need to make over time.
I study horses, beauty.